Now, at the front line of the fight against coronavirus are healthcare workers. The lack of personal protection equipment is an issue in many different countries. One group of doctors in the UK said NHS staff felt like lambs to the slaughter. Let's talk to Howard Catton, who's the CEO of the International Council of Nurses, which represents 20 million nurses worldwide. He's in Geneva. Welcome here to the programme. How alarmed are you by what nurses around the world are actually facing here?
I am really alarmed. We heard at the end of last week that the rate of health worker infection in Italy was at around about 9%. That's too high. That worries me. But in the last 24 hours, we've heard of a figure of 12% in Spain. In addition, tragically, in the recent days, we've also had news of deaths of nurses in Iran, Indonesia, in Spain, in Italy as well. We must prioritise and protect our nurses and our health workers right now. Their lives are at stake, but also we need to keep them working. This thing is going to run for weeks, possibly months yet. We need to support our health workers through this, and at the moment we're at risk of exhausting them.
I'll come back to some of those questions in a moment, but in terms of actually what is happening, are nurses currently treating coronavirus patients without the protective equipment they need? I was listening to one nurse yesterday who was talking about making their own apron out of plastic bags here in the UK.
We've got a problem with the supply of personal protective equipment. That has meant that people have been reusing personal protective equipment for longer. They've had to be thinking about prioritising the use of PPE as well. We need manufacturers to step up. We need to increase the supply. There are some really important issues as well about ensuring distribution. The difficulty with flights has not helped with some of that. Countries can do more to cooperate as well to share the distribution of PPE around to make sure that people have the supply. And we need to be thinking as well, it's not just about in hospitals, in our aged care, our nursing homes, our social care facilities. We need to get PPE to those places, but also people need training. Yeah. This is not easy to put on. If somebody gave me a scuba diving set and said, go diving, I would struggle. Similarly, nurses, health workers need training for PPE as well.
Absolutely. So let me ask you a brief final question. In terms of testing frontline staff, which is so vital, what you touched on, which sort of countries are doing well on that? And of course, many countries, especially in Europe, the US, they had 2 months warning. Are you surprised that so many countries are in the difficult position they're in on this?
Well, look, I've been talking to nurses from many countries, but particularly I've been impressed by what I've heard from China, Korea, South Korea, Taiwan as well. Test has been really important, but they've then also contract traced those people who might be in contact. They've used technology to tell people where people who have been infected, where they have been as well. They've taken this fight to the virus. They've gone after it, and I think they're seeing some results. None of us know what the future holds, if it will mutate and if it will pop back again, but really going seriously after this. And for those countries that haven't had a big hit yet, particularly worried about Africa, these messages about prepare, get PPE supply and get these messages out to the public, test and isolate, I think are critically important.
All right, we have to leave it there, but thank you so much for joining us on the programme.